Ovulation is a discharge of an egg from a female's ovaries and its necessary process to conceive. Ovulation is precipitously activated around 36 to 40 hours of the blood levels of a hormone called luteinizing hormone rise. This is known as the LH cloud. Once discharged from the ovary, the egg is gotten by and goes down the fallopian tube where it can meet sperm to be fertilized. In the event that a woman is attempting to discover the explanation why she is not getting pregnant, it's useful to know whether she is ovulating. Having normal menstrual periods somewhere in the range of 21 and 35 days long, joined by menstrual issues, is a decent sign of ovulation. There are a few different ways to test for ovulation, including the basal internal heat level graph, urine test kits to quantify LH levels, blood tests to gauge levels of specific hormones, and transvaginal ultrasound. Estradiol, a kind of the hormone estrogen, is created by the follicle as it develops, and its levels go up rapidly just before ovulation. On the off chance that fertility prescriptions are being utilized to make a woman ovulate, estradiol levels are checked all the more regularly to watch out for the development of the follicle. An ascent in the LH level in the blood can perceive when the follicle, sac where the egg is ready and prepared for ovulation. Since LH is discharged in strokes or short blasts, the LH blood isn't constantly found by salutary blood or urine test. Rates of progesterone levels in the blood 7 days before the menstrual period, as a rule, shows ovulation has happened. Urine test kit. These home test packs are accessible over the counter and show change in the degree of LH in a woman's pee. Since LH hormone develops in the urine, when it's distinguished in the urine, ovulation as a rule happens inside 12 to 24 hours, for the most part around 14 days before the beginning of menstrual period. For ladies with sporadic periods, urine testing ought to be coordinated by the most punctual and most recent potential dates one is relied upon to ovulate. Urine testing for LH blood should start at any rate 2 days before the normal day of ovulation and proceed until the LH blood, or through day 20th. Fertility test packs check for both LH and estrogen in the pee. This doesn't really expand the odds of pregnancy and ought not be utilized on the off chance that you are taking meds to enable you to ovulate. Transvaginal ultrasound. The egg created inside a part of the ovary called the follicle. As the egg prepares to ovulate, the follicle becomes bigger. Follicle development can be estimated with ultrasound, a strategy which uses sound waves to create a picture on a screen utilizing a tampon-like test put in the vagina. Prior to ovulation, the follicle is flimsy walled and loaded up with liquid. Ovulation for the most part happens when the follicle gouges somewhere in the range of 1.8 and 2.5 centimeters. For women having treatment for fertility, ultrasound may help time to intercourse or insemination. Women taking fertility drugs, ultrasound might be done on a few unique days during the menstrual cycle to gauge and screen every follicle. Basal internal heat level chart. Everyday estimation of basal internal heat level can help decide why the ovulation has happened. Notwithstanding, basal internal heat level is just a gauge of ovulation timing and can affirm that ovulation has occurred. However, one anticipates when it may happen. In spite of the fact that not exceptionally supportive or exact to timing to intercourse, it's a simple approach to have information at home. Despite the fact that deciding whether and when ovulation is happening may appear to be disappointing and tedious, it's regularly a fundamental step toward accomplishing pregnancy. It's significant that women work with their primary care providers to choose which technique for ovulation is best for them. On the off chance that these tests demonstrate that a woman is not ovulating or that she has periodic cycles, medications are accessible to address the issue and boosts the chances of an effective pregnancy. Knowing your body health and educating yourself is an effective way to prevent any negative outcomes and get right treatments.